Hey Columbus, this is Troy with Ohio Men's Health. Welcome back. Hey, today I'm going to talk about one of the frequently asked questions that we get on our website and from phone calls, which is, what does testosterone replacement therapy do? But before we get started today, first I want to let you know how to find us. You can go to our website at columbuslowt.com. You can also contact us directly, 330-662-1030. You can contact us by phone or also by text. If you're on YouTube watching this, please subscribe. Each time a video pops up that we do, you'll see that come right into your email. You can find us on Facebook just by searching Ohio Men's Health for tons of information. So today, what does testosterone replacement therapy do? First, to answer that question, let's talk about what is testosterone replacement for. So who is it for and what is it designed for? So testosterone replacement therapy first is designed for someone who's a male over the age of 35, or preferably 40 or older, and starting to develop symptoms of what we're going to call male andropause. And male andropause is when testosterone levels begin to decline. And it naturally declines for some men with age and not all. But on average, 1 to 2% per year, testosterone is going to decline. But as it declines, some men begin to run into symptoms. So symptoms are fatigue, brain fog, what we're going to call dysthymia, which isn't necessarily depression, it's just kind of depressed mood, not as excited, not as motivated about maybe things that we were in the past, decreased libido, so sex drive goes down, maybe sleep disturbance, exercise tolerance, recovery tend to be affected where we're just not tolerating exercise as well. I mean, we just don't have that fifth gear. Maybe we're stuck in third gear, the recovery. Perhaps you're just sore for days on end. You work out on Monday, moderate intensity, and you're still sore on Friday and just not recovering from exercise. We're seeing some adipose deposit maybe in the midsection belly, kind of back fat, back behind the arm in the latissimus area or the lats. Those are the main symptoms. Erectile dysfunction, yeah, it's a small percentage of men, but it's there. We see some erectile dysfunction. Typically what we see is that the quality and stiffness of erections isn't quite as good, rather than just true ED with testosterone replacement, but it does happen. Now, so that's who and what testosterone replacement therapy is for. So to answer the question then, what is testosterone replacement therapy? When we identify men with those symptoms and then we draw labs and we see that testosterone is decreased, typically below 450 or so, somewhere in there, that's a guide, doesn't have to be an absolute, so that's a guide. We'll see that the testosterone should be, say, 700 to about 1100, but then when it dips down below 500, below 550, that's when these symptoms begin to creep in. That's where we see most men present with these types of symptoms. And a lot of times it's a partial androgen deficiency, meaning that it's partially decreased and not completely deficient, but a lot of times you run into men with a complete deficiency. So testosterone replacement therapy then is bringing the testosterone level back up to normal. We're not looking to bring the testosterone back up to or take it to like performance enhancement, like where it's off the charts, it's undetectable on labs. We're not looking to performance enhance. We're not looking to build bodybuilders with testosterone replacement therapy. Our goal is to manage the symptoms of the androgen deficiency. And the symptoms are, as I discussed earlier. So we're bringing testosterone levels back up to quote unquote normal, or where they were perhaps in our younger years, and then monitoring to see how do our symptoms respond. And for 95% of men, we tend to see the symptoms respond favorably. And in one of my other videos, we talked about, replacement therapy. Hey, you got to be a little patient, good communication, frequent labs, medication frequency. It's different for everybody. So a lot of men respond differently and need different types of treatment based on the problem, and not everybody responds the same. But this is who testosterone replacement therapy is for. So again, if you're looking for us, you can find us on columbuslowt.com. You can go and subscribe to us on YouTube, TikTok by looking for Ohio Men's Health, Facebook by looking for Ohio Men's Health. I look forward to seeing you next time as we continue answering some of the frequently asked questions. Have a great day.